Welcome to Sage Women, the podcast where wisdom meets empowerment. I'm Melanie White, your host, and I invite you to join us for inspiring stories and evidence-based insights that support women's health. From expert advice to real-life experiences, we'll help you to thrive through menopause and beyond. And remember to hit the subscribe button so that you get the latest updates every fortnight. Hi there, it's Melanie White on the Sage Women podcast, and I'm really pleased to have today's guest here who's doing a PhD into menopause, such an important area. We have Jo Reid, who is the Nurse Director of Sir Charles Gairdner Hospital, Osborne Park Healthcare Group. I think I put the word hospital in there by mistake. It's a long title. Thanks for being here, Jo.
Pleasure.
And we'll be talking a bit today about your PhD, which is super interesting in the context of the recent Senate inquiry into perimenopause and menopause. Obviously, we don't understand enough about what happens to women in the workplace. And I understand your PhD is about exploring the experiences of nurses and midwives through menopause in the workplace.
Yes,
really interesting. So I guess to kick things off, I'd love to just understand a little bit about you and your background so we can set the scene for how you ended up working in this area around menopause and doing a PhD in it.
Thanks, Melanie. So yeah, my name's Jo. I'm currently a nurse director in corporate nursing, as Melanie said, and I have so I suppose my experience over the last. Well, I emigrated to Australia in 2005, so I've spent the last 20 years in Australia in a variety of positions in coordinators of nursing role as well as nurse director positions. And I got to a point a couple of years ago where I was thinking maybe I need to do something a little bit different. I'd never necessarily really thought about progressing a research pathway. However, I was lucky enough to get picked out of a hat to go and attend a conference in Perth. And I heard Ravani Duggan speak, who is the associate professor at Curtin School of Nursing here in Western Australia. And she was doing a presentation on some of her research and indicated that she would like to progress in the menopause space. So I heard that at a conference just in the background of the stage and thought, oh, that's interesting. So I went and chatted to Ravani, found her out in the conference and said, hi, I'm Jo. And that was really interesting. Something that, is resonating me at that point in time. Lots of friends, myself thinking about the impacts of menopause and lots of just those personal stories and trying to, I suppose, navigate those kind of symptoms and things and just feelings that we were having. So yeah, had that conversation with Ravani and essentially left the conference agreeing to do a PhD. So it still blows my mind that I got picked out of a hat, attended a conference, and when I came away, and interestingly, I had started to again of my professional journey. Maybe you need to start saying no to things sometimes because you have got so many things on. So I left and told my friend, and she's like, why did you say yes again? I said, I'm going to be really interested, and it's something that I'm very passionate about. So yeah, that's how I've started to begin that research journey as something that I never thought that I would do, but very super excited about it.
And what is most exciting for you about the work that you're launching into, this research that you're doing?
I think, Melanie, in terms of that menopause, I suppose the menopause narrative and the things that we hear about menopause, that I'd seen lots of podcasts, lots of things on social media. And again, as a group of friends predominantly, we were having lots of conversations about how we were feeling. And again, the group of friends that I'm referring to, we're all nurses working in healthcare, pretty experienced, but couldn't understand how difficult it was for us to navigate that when we actually are experienced, working in professional positions. And then those stories really resonated with me. And specifically for nursing and midwifery, essentially the nurses and midwives as part of that global health workforce, there's probably about 89% that are nurses, 93% are midwives. And
Wow.
in Western Australia, certainly as I've been starting to progress my research journey and understanding the demographics, there's and also that I suppose also understanding that menopause can last for that 50, potentially up to 15 years, and thinking, oh
Mm.
my gosh, as a professional group, which is predominantly female, um, is going to be experiencing menopause and probably working through the whole of that journey. And if myself and my friend group are not really fully understanding and appreciating those impacts, then how does that impact on everyone else? So yeah, that's probably what has resonated with me.
Mm.
Also, in my role as a nurse director within corporate nursing, I'm also involved in a lot of projects that would go across the organization and impact specifically in that workforce space. And
Mm.
our people are our most valued asset within an organization. And unless we invest in our people and support our people, how are we then going to be able to provide the
Mm.
excellent patient care that we want to do? So I just think it's a really important topic.
I see you're coming at this with a couple of different perspectives, your
Mm,
own lived experience and the chatter you're hearing amongst your friendship group, and then in your role as a nurse director, what does this mean for the workplace,
mm,
and how can we keep nurses at work and working at their best? I mean, there is definitely a bit of a frontline worker crisis in Australia. I
mm.
understand a lack of people in these professions, and retaining workers is probably a really big priority, I'd guess.
Mm, definitely. And I think, Melanie, as you've said, those links to well-being, because, we come in, and I think from a nursing and midwifery perspective, and when I talk about nurses and midwives, and while the research is predominantly focused on that group, I anticipate that the findings, for whatever they will absolutely be able to transition to all different groups of occupation who work anywhere, really.
Mm.
So, especially because because I'll be focusing on that personal experience of people within that workplace setting. But as you've said, the links with well-being, keeping people well in the workplace, but then also trying to break down those barriers of sharing that experience as well, because I think again, it's the stories for me. It keeps coming back to the stories. Some people sail through menopause, perimenopause, and
Mm.
don't necessarily have a story related, but there's others who share their very unique personal story about how it's impacted them. And it's just blown my mind in terms of the impact that it can have for some, not everybody,
Mm.
but anything that we can do to normalize the conversation, to support those nurses, midwives, whoever within the workplace can only result in better outcomes for everyone.
Mm. And perhaps I don't know if you've seen this before, but I've noticed that even amongst women, some people say, "Oh, I didn't have any problem with menopause," and there are women who've had significant problems who, in that same conversation, have felt dismissed
Mm,
and unheard because they've really been struggling with things. But someone said, "Well, I didn't have that experience. It was
yeah.
nothing for me." And you may or may not have seen that, but I'm just also aware of, even amongst cohorts of women, that openness and understanding and empathy seems to be really important.
Mm, yeah, absolutely. Absolutely. And I think you touched upon again the back to the stories. There are a couple of and the research, because as part of my PhD, just in terms of my stage,
Mm.
I'm now at milestone one, which is great. So the
Awesome.
milestone yeah, it was definitely a celebration. So the milestone one was essentially where you present the proposal, you do a presentation to the university, and they essentially sign that off to say, yeah, this is a great piece of research to do. But that's taken, probably a year, maybe around about a year to kind of get to that stage. So in doing that, that's looking at the literature, looking at, how am I going to conduct the study? What am I going to do? And the research that I've done in terms of reviewing books and articles and things, a couple of the things related to workforce that, again, made me think differently, especially in a position what I see currently as a privileged position. I'm able to influence and use my position to influence on behalf of, nurses, midwives at executive tables and things like that, which is really important.
Mm.
But hearing some people, again, stories, considering resigning from positions or not seeking promotional opportunities and feelings of shame, they were some of the things that came out of the research and made me think, gosh, if genuinely people feel like that within the workplace and they're choosing not to want to progress because of that, and it is related to something where we can at least provide support, yeah, surely we have to, continue to try to make a
Yeah.
difference.
Yeah, yeah, it's so important. And
Mm,
you're obviously picking up on some really critical threads for the future of nursing in Western Australia and in Australia. And as you say, it can be translatable to other
mm,
areas. I'm particularly interested in the fact that in the nursing workforce, there are so many factors outside of someone's control when it comes to their job. I know it's early days and you might not have touched on that, but I'm thinking about shift work
mm,
and different schedules. And there's, in a way, a lack of job control in some areas. And I'm really curious to see how that will unfold and impact somebody's experience where that intersects with menopause. But
mm.
probably a little bit early to talk about that.
I think again from the research perspective and undertaking the literature searches that definitely has come out, and I think as you said, Melanie, the nurses and midwives predominantly cover a 24-hour period. They're the frontline workers, and while we want to try to offer that flexibility, in some instances that is impractical, especially when people are expecting to do that 24-hour cover.
Yeah.
So again, but being able to highlight that and talk through that and actually explore what opportunities there are in that space. And
Mm.
also, again, knowing that not everybody goes through menopause and not everyone has the same experience. But if we are a connected workforce and have that connection with each other and understanding of what that means, then there's
Mm.
also that ability for us to support everyone regardless of what area of their life they're currently in. um there's sometimes references to that parental leave. We have the parental leave for people. We've also got workers who are managing elderly parents, or we've got workers who, are single and having to navigate home lives. There's so many different experiences, but if we are coming together connected with that care and compassion and understanding, then hopefully
Mm.
we can make some changes that do make a difference.
That really strongly aligns with a recent episode I recorded for the podcast with Sarah Mackay, who's a neuroscientist and was talking about how incredibly important social connection is for well-being
Mm,
and health. And then it also ties in, I don't know if you've seen the recent Gallup research into having friends at work. And if you
mm,
have friends at work, uh, your likelihood of leaving that job is significantly lower than if you
mm.
don't have friends at work. So anyway, we could go off in another tangent, but it's just so interesting that sometimes it's some really basic concepts that
Mm.
make the biggest difference or a big difference. Yeah.
Absolutely. Interesting you said that from the Gallup perspective, we had recently done one of a survey, and yeah, that was what obviously that is one of the questions about whether you have that. I can't remember how it's termed, but as you said, the connections that we have with our people and the understanding of what they are going through, and it is so important. I just had a meeting with my team just yesterday actually, and we were talking about that. How do we connect? We sometimes might present ourselves in silos within our own teams, but if
Mm.
we actually kind of come out of those maybe silos and start to connect at a broader level, then we've got that opportunity to cross-pollinate, have different ideas, different understanding of each other, but we're stronger together. And again, and I always talk about, sometimes we talk about nursing being a tribe, midwifery being a tribe, but we're only one tribe of many, whether it's
Mm.
allied health, non-clinical professional, people who are in those clinical corporate roles, medical. There's so many of us who if we kind of can come together and do that connection, it's it will be great.
I think you just came up with a great tagline, Stronger Together.
Yeah.
That's awesome. Jo, can you tell us a little bit about the aims and objectives of the research that you're doing, your PhD, and we'll have some conversation around that.
Yeah, absolutely. So my title is to explore the personal experiences of nurses and midwives transitioning to menopause in the workplace. And I've crafted, I suppose, like four objectives. One of them is to look at describing that transition within the clinical setting, but then also to look at what are the symptoms that are impacting the quality of life of nurses and midwives. And then also to look at that menopausal transition and its effects on workplace performance. And then also to hopefully look at what transition supports might be required by nurses and midwives within that clinical setting. So they're I suppose, the high level objectives. My target audience. So for anyone who isn't familiar, so within the area that I work in, which is North Metropolitan Health Service, we're within Western Australia. And we are unique within this organisation that we have 3 tertiary sites. So we have the Sir Charles Gardner Osborne Park Hospital Care Group, which incorporates a tertiary hospital, and then we have a specialist hospital. But then we also have mental health, public health and dental services, which is where our mental health patients are, as well as community services and public health as well. And then we also have the women's and newborns service as well. So that's another tertiary site. So it's quite unique in Western Australia to have 3 tertiary sites within one health service provider. So my target will be nurses and midwives working across those 3 settings to hopefully give a quite unique perspective. And again, having both nurses and midwives to target in that sampling.
Could you explain for people listening who might not know what a tertiary hospital is?
So a tertiary hospital would be one that has I suppose, all of the specialist services, the acute hospital environment. So, for example, Sir Charles Gardner Hospital, we've got that emergency department, we've got all of the specialist services that require that really acute high-end service. And similarly, the tertiary facility that we have within mental health, again, it has and also a lot of the sites that we have will have those statewide services as well. So really essentially providing that very unique acute care services that is required. And yeah.
Okay, so it's an all-in-one, one-stop shop kind of hospital.
Yeah. For each of the different, and the women's newborns health service. So again, that's again those I suppose the tertiary level services for women, whether that is throughout their journey of their own the kind of their own health challenges, or they're going to deliver babies, and they might have just require that more intensive intensive support.
I can imagine that nurses working in those settings must have a lot to deal with, probably vicarious trauma in some cases and long shifts. I'm also wondering, how many women are we talking about in that kind of menopausal age bracket that you might be working with?
So when I again pulled some data as part of my research proposal, within the age bracket of round about between age 45 and 60, to acknowledge that the whole menopausal transition, we would be talking in excess of about 2,000 nurses and midwives in that age group.
Wow.
But not obviously, but we also would appreciate that there are other instances where people might start that menopausal transition early, whether that's through, kind of surgical procedures that they might well have had to have. So we do acknowledge that menopause can start in different ages, but within the 45 to 60 age group, we've got, in excess of 2,000 nurses and midwives who would fall within that category.
And then I guess before that, there's almost like the next generation of women who will become menopausal and
Absolutely.
stepping into those roles as that current cohort transitions into retirement. Wow. And so what are your longer term goals for the research that you're doing? You talked about understanding how symptoms impact quality of life and workplace performance. And I've got actually your 4 points here that you'd sent me, the supports required in a clinical setting. Where do you see this going in the next, say, 5 to 10 years as your research concludes and you start to look at strategic planning, perhaps?
I think interestingly, again, I suppose as you immerse yourself in this kind of topic and look at the research and everything, there are so many different other elements that also come in and that help to, I suppose, frame your thinking. In terms of that support mechanism, to me, it would be about having I don't know, Melanie, I did the Menopause Ambassador course, which was great. So, and that actually has helped me to further have really good conversations with work colleagues and with other people. So the ability to actually implement support into the workplace, but I'm not necessarily sure on, which is what I hope my research will say what actual supports is required, because I think there are so many different, again, back to the stories, there's so many different stories. And when I just have conversations with colleagues, I'd love a GP on site who can absolutely provide that menopausal support, because I work shifts. I'm very limited in the times that I can go here, like kind of go and attend appointments. It would be great if there was someone on site who could do that. Somebody else had said, what about if we had like a nurse practitioner-led service that was somebody there who specialized, but and was able to just be available to have a conversation with, or to go and have an assessment or an overview. Or is it just as simple as continuing to have the conversation so that managers and colleagues actually understand that while Jo, for example, has been pretty on point and on game and everything, but she seems to keep forgetting things every so often and possibly brain fog, or she's not able to remember what that cup is in front of her, but she knows it's a cup, but she can't necessarily say what it is, even though she knows that it's there. And then it's actually not that Jo's going crazy. It's just that she's maybe just having a moment. So, or if you start fanning yourself, that those things, if and other people know about that. But what I don't necessarily think that one support is going to kind of meet everybody's needs, but I think, and that will be the value of this research, is because we are going to be looking at the symptoms that people have, but I'm also going to be conducting one-on-one interviews with people as well, to actually understand what they are and what supports they might think are required for them as an individual. But then the final stage, which will depend on my survey that I do and my one-on-one interviews, it will be bringing together an array of different people, whether that is human resources, our work health and safety teams, maybe our employee engagement teams that we have, to actually bring everyone together and say, this is what the research has shown. What is it as an organization we can realistically do to actually try and make a difference based on what the research finds? And that's what I'm really, hopefully, I love that connection with people. I'm really excited. Maybe excited's not the right word, but I'm just genuinely interested about the experiences of the people that I am going to be liaising with and having conversations with.
I love the sound of that. You sound very passionate too. I can hear that you really like connection
Mm,
hearing people's stories. And I think you touched on a really important point, which is bringing all of the different stakeholders together to say, what can we do collectively? Because I don't know about you, but when I speak to organisations about how they're managing things like menopause, often we hear that they're quite siloed. We have OC health and safety here, we have people and culture there,
yeah.
and they might not necessarily talk to each other and work together or look at ways that they can work together on a common issue. So I love that you're developing a model of care or thinking about that model of care for a workplace, and how do we bring together those stakeholders to address these issues. And you also had some really practical and simple ideas. I mean, having a GP on site or a nurse practitioner, that sounds great. It doesn't have to be complicated, does it? There might be half a dozen things that a workplace can do, or particularly in your case, that a hospital could do to support women, and it doesn't have to be a big onerous shift necessarily.
It's interesting. I was thinking about that just yesterday, actually, because we have a pharmacist just based on our hospital, so our tertiary hospital, so that anyone can use that pharmacy. And just again, someone who works full time, who, days are long, don't always necessarily get to the chemist, but the ability to go to the chemist and be able to get my prescription. And so yesterday, I picked up my gel yesterday from the vet, and it's just amazing. Just that one little thing makes a big difference in my day because I don't have to be thinking about it. So as you've said, Melanie, just those small changes make a difference. And I was just reflecting on what you said about the connecting lots of people as part of our again, I did the menopause ambassador course, which was great. And for World Menopause Day, myself and a couple and Ravani, who's my PhD supervisor, who is amazing, and it probably makes my PhD journey very enjoyable. And a couple of others, we did a panel on menopause on World Menopause Day, and it was interesting. It was attended by so many different people. We had administrative people, we had doctors who came, allied health.
Wow.
So it was a really good connection. And again, back to the stories that people were sharing with us. But it was very clear that it isn't just, it is so important not to just think about it in one area. It actually impacts everything. Everybody is involved. And again, comes back to that we are stronger together, that if we collectively come together and decide what or determine what would work, then that's going to be, yeah, that's going to be great.
It's really inspiring, Joe. I'm such a big fan of the work that you're doing. It's so important, and you sound like you're so enthusiastic. It seems like such a great fit for you, and we're really excited to see what you uncover and what leads from that. It sounds like you are going to leave a really big legacy professionally.
Yeah, actually, that's what I remember when we were having a conversation before the podcast, because I was a bit nervous about today, but this has been a nice experience for me as well. And I kind of thought, why I've always thought about, what professionally, what do I want to do in the future? And that legacy component, I'd always say, like, but what does that legacy mean? Like, what does that mean? But what I suppose, thought about in that space is that if my research can help people now who are in the workplace, but can also impact intent potentially for the future, then that in itself will hopefully be a bit of a legacy that I leave as a health professional working within Western Australia. And I've got a daughter, so she's just started her nursing journey. So again, when she gets to that stage, hopefully, if there are something that I've managed to impact, then that would be great.
Love it, Joe. Thanks so much for being on the podcast today. I really appreciate your time, and such a big fan of your work. Keep us posted. And if there are any links that you'd like to share in the show notes for this episode, please pass them on and we'll be sure to pop them in for anyone listening.
That's great. Thanks, Melanie. This has been a really positive experience. So thank you for inviting me. And yeah, definitely we'll be back in the future to hopefully share more insights.
Updates. Fantastic. Thank you, Joe.
Thank you.